Yeah, hi everyone. Welcome to my YouTube channel. My name is Dr. WAN, and today we're going to talk about asthma, how it is being managed. I know in Africa it's not as chronic as compared to the Western world, but for sure there are cases of asthma there. So that's why I want to make this video, so it's going to help most of my followers and also students how to handle cases of asthma. Overview of asthma drug therapy, organizing asthma medications into 4 main groups based on their role in asthma management. So here the first one, as you can see on the table, is relievers. These are short-acting medication used for quick relief during asthma attacks or sudden symptoms. And these relievers are divided into subclasses. So we have class A, which is short-acting beta agonist, known as SABA, with the famous acronyms. And these SABAs release bronchial muscles quickly to open airways. An example of SABAs, we have salbutamol. Then we do have also phenterol. We do have Venolin, which is the commercial name for salbutamol, which is almost the same thing as albuterol in the United States. So those are the drug that belongs in the class A. Then we have now class B, which we call them anticholinergics. So anticholinergics are the one that blocks the bronchoconstrictive effect. That's, they have a bronchoconstrictive effect of acetylcholine. So they block the bronchoconstrictive effect of acetylcholine. An example for this one is ipratropium, or the commercial name is Atrovent, and then we have, or another one could be Ipvent, or the tiotropium. So those are the 3 that belongs to that class. Now we go to class 2, which I call them controllers. The controllers here, these are long-acting beta agonists, known as LABA, used for maintenance therapy to prevent symptoms over time. An example here is formoterol. That's what is used, or salmeterol. So those are the 2 drugs used in this case. Note, controllers are not for immediate relief and are often used alongside preventers. So it just goes to say that you need to first of all use the SABA first, so it creates room for the LABA to get in. So it's not as if when there's crisis you give the person just LABA. That won't help in any way. Now we have the preventers. These reduce inflammation and hyper-responsiveness of airways, used daily for long-term control. And in this case, we have the ICS, which stands for inhaled corticosteroids. So that's what we use here. So we have also class A and class B. So for class A, the ICS. And a good example is cyclozonide, or beclomethasone, or budesonide, or fluticasone. So those are the medications that we use here most of the time, I would say regularly. Then for B class now we have leukotrienes, the leukotriene receptors and agonists, which are oral medications that block inflammatory chemicals called leukotrienes. An example of the leukotrienes, we have the montelukast. The montelukast now are popularly known as Singulair, are what we use here regularly. There are various pharmaceutical forms. You have them in tablets, just like you have them in inhalers. Then we have now the next class is we call them combination or combo. So for those combos, we do have this inhaler combine a corticosteroids and a long-acting beta agonist. So we have the ICS plus LABA for both inflammation control and airway dilation. A good example here is budesonide and formoterol, or fluticasone and salmeterol, or we have the Symbicort, which is a budesonide and formoterol. So that's it. So a summary of the table that you will see on my cover page, those are the things that you will see them there. We have category, purpose, and example, then followed by generics. Relievers, immediate relief, salbutamol, formoterol, ipratropium. For controller, we have the long-term acting, relaxation, formoterol, salmeterol, and the preventer, which we have the one that goes alongside to reduce inflammation. So that's what they do. And then we have the combo, which I said before that they do have the dual action. That is the ICS and LABA, budesonide, formoterol. Then it could also be fluticasone or salbutamol. So those are the things that you have to know if truly you want to handle cases for asthma. Then that's what it's gonna look like when it comes to a therapeutic aspect. So far so good. My name is Dr. WAN. Whatever you don't understand, please do not hesitate to get back to me. I'm more than happy to give you further information when it comes to asthma management. Thank you and have a wonderful day. Please subscribe to my YouTube channel, share the video with your loved ones. Thank you and bye.